Hi, welcome back to my channel. If you're new here, welcome. My name is Aminata. I am a nurse practitioner. And on today's video, I'm going to be talking to you guys about some helpful tips or things to know if you are a brand new nurse to help you be successful. So being a nurse, I totally understand what it's like to be a brand new nurse. And over the years, I've gotten the opportunity to precept some pretty amazing new nurses. And also when I work as a clinical instructor, I was able to work with some amazing nursing students that are pretty much at the end of their nursing schooling and getting them prepared to be to graduate. So today I wanted to talk to you guys about some very helpful tips to help you if you're a brand new nurse. Some of these tips you can use it even if you're not a brand new nurse. So let's get right to this video today. So first of all, the first thing you want to know as a brand new nurse is that unfortunately nursing school really doesn't prepare you well enough to take on a patient load as a brand new nurse or as your first patient assignment. So a lot of the time as a nursing student, you're most likely taking care of one patient. Sometimes, so for some nursing students, they're able to push themselves a little bit more, or they're able to have 2 patient assignments a day. But at the end of the day, you really don't get a full patient load as a nursing student, and that really doesn't prepare you well enough. So with that being said, knowing that as a new nurse, your job is going to prepare you. So for most jobs, you have anywhere from 2 months to 3 months as to for orientation, in which to prepare you for your new role as a nurse. So just knowing that even though nursing school doesn't prepare you well enough, that your job is gonna prepare you, or the hopes is that the job is gonna prepare you to take on that full patient load. Okay. And then the second thing that you need to know as a brand new nurse is the fact that you are going to struggle a little bit with time management. Again, you're new to the profession. You're going to be moving a lot slower, but that's okay. All right. As time goes on, you get better with your time management. So sometimes it's not surprising for new nurses to, after working a full 8-hour shift or after working a 12-hour shift, having to stay at least an hour or 2 hours after that time just to document. And the reason being is that you are new as a nurse, and a lot of the things that may take a nurse that's been working for several years, 1 minute or 2 minutes, for you it might take you 5 minutes. And just knowing that, don't get frustrated. It's okay. Everyone goes through those steps. Everyone goes through those hard times. It's okay, and that it gets better. So as time goes on, you develop better time management. An example for that would be for me when I worked as a critical care nurse. Most of the time you're working with 2 patients. At times, if your patient acuity is a little bit lower, you may take care of 3 patients a day. So some tips that I usually do to help me with time management so that way I'm not staying later on to chart, is that when I go in and have my patient assignments for that day, I go in and check on my patients, make sure that everything is going okay, check my drips, have a quick glance at my vital signs, making sure that my patient is stable, and then I go back and have a plan for that day. So usually I'll try to go in the patient's room that have less medications, give my medications at that time, do my full head to toe assessment, and sometimes depending on what's going on, I'm able to start documenting while I'm in the patient's room. Maybe I'm able to document some of my complex assessments, which just means that your full head to toe assessment. Sometimes I'm able to do my vital signs, and sometimes I'm able to document my lines and drainage, which would be like your IV, if your patient have Foley and all that stuff. So that way, once I leave that room and go to my next patient, I have some documentation. Sometimes I'm able to actually document my full documentation for that patient before moving on to the next one. Sometimes things changes. So that's just a thing that I've used over the years. So that way, usually after I'm done for that day, like when I give a report, I'm usually just able to leave because my documentations are in. But if you're starting, it's okay. As time goes on, you find out which areas that you're struggling with, and your time management gets a lot better as time goes on. So knowing that time management is going to be a struggle, it's very big for new nurses, and that's okay. Just knowing that, I think the key point to this is knowing that you are going to struggle, but it gets better. Okay, so don't get frustrated. Okay, and the next thing is that, so as a brand new nurse, when you're starting orientation, they assigned you to a preceptor, and that person is going to help guide you through your first few months of orientation. And they're going to show you the ropes, things on what to do and things not to do, pretty much help prepare you for when you're on your own, when you get off of orientation. So one thing that you need to really keep in mind of as a brand new nurse is recognizing if you're struggling with that preceptor. So some things to kind of watch for: if you see that preceptor is kind of taking over everything, where they're not really letting you do a lot of the work, that becomes a problem. Where they come in, you get report from the nurse, and they seem to pretty much do everything. So to some extent that can be a problem. So if it's your first month of orientation, depending on where you work, that preceptor may need to be hands-on for the first couple of months, and they show you what to do for the first month. And as time goes on, they need to be able to let it loose a little bit, where they're able to let you do most of the work. And as you get closer to finishing your orientation, you should be able to do all of the work, where they just be as a backup person for you. So, but if you're having someone that's a preceptor that's pretty much from the first month, second month, is still pretty much doing everything, and they're not letting you do most of the stuff, that becomes a problem. Or you have a preceptor where right off the gate, they're like just letting you loose and you going in and you're doing everything. That's a concern. So because in that first month or so, it becomes very critical, because you're still learning and you need to have that person be there with you when you're doing things. So trying to find a balance between a preceptor that's able to monitor you, especially in the beginning, and help show you the rope, and as time goes on, they let you do more stuff, that's usually the way to go. But if you're finding the opposite, where they're letting you, not teaching you anything at all, and they're doing everything, or they're letting you do everything, it becomes a concern, and you want to make sure your manager knows about it. Because again, that first couple of months of orientation is going to be very important, so that way it prepares you for the next stage of your career, which is you being on your own and taking care of your full patient workload. And if you don't speak up, it becomes a problem, and you're the one that's going to suffer, because the things that you're supposed to learn while you're in orientation, you ended up not learning those things, and you get off of orientation and you're asking these questions that you're supposed to learn while you're in orientation, but because your preceptor wasn't really good at teaching you and you didn't speak up, that becomes a problem. So you want to really make sure you speak up if things are not going well. Next tip is to know that as a nurse, it's going to be a teamwork approach. So if you're just thinking that I'm just going to go in, get my patient assignments, and just focus on my patients, it's going to be a struggle for you, because we need each other. When you're working as a nurse, you're going to work with teamwork with the therapist, with the caseworker, with the CNA. So there's some days where you're charting and it seems like you are doing more stuff for other people's patients than your patients, and there's some days where people are doing more for your patient than they're doing for their patient. So just know that it's going to be a team approach. So make sure that you work with your CNAs. There's no such thing as a job that's beneath you, okay? You're going to find a lot of time you're doing CNA related work, and honestly, those are the best moments of my life, when I'm actually able to connect with my patients. So something as, especially when I work night shift, I'm giving back rubs because I need my patients to sleep. And sometimes you just get so restless, and they're used to being home. All of a sudden they're in this new environment. So you get confused for the elderly patients. So anything that you can do to make them feel comfortable, and a lot of those things does not involve you passing medication, placing an IV, or things that are quote unquote nursing related tasks. So a lot of the time you're going to be spending time cleaning up your patient, taking them for a walk, getting them some water, feeding them. So if you are comfortable doing those type of jobs, and your CNA notice that you're helping, that's going to make things really put you in a good standing with your CNAs and with the other nurses, because you're willing to play ball, and you're willing to be more involved with the patients that are not yours, and you're willing to be a team player and help out. The last thing that I wanted to talk to you guys about when it comes to being a new nurse is just don't be afraid to ask questions, okay? And again, you're a new nurse, you're learning this new role. There are a lot of things that you don't know, so don't be afraid to ask questions. It's good to have some confidence, but overconfidence will become a problem. So ask questions if you're not sure about something, and that's the beauty about being a new nurse, is that you get to say, I'm new at this. That's why I'm asking questions. So don't be afraid to ask questions, guys. And that's the one thing that when it comes to, there's no such thing as a stupid question. In nursing, and you're dealing with people's lives, If you are feeling some type of way about something that's going on with your patient, please make sure you ask for help or ask questions. And that's pretty much it for this video. And guys, you have made it this far in terms of going through nursing school. You're gonna do great. It's okay if you're nervous. Every one of us is nervous when you're starting your new job as a nurse. And just know that you're gonna do great. You're gonna be an excellent nurse, and you have what it takes to be a great nurse. Okay, I hope these tips are helpful. Comment down below and let me know if you're a brand new nurse, if you just started working, or if you're finishing up with your nursing career and you find this video to be helpful. Please make sure you like this video, subscribe to the channel. I talk a little bit about nursing on this channel, a little bit about mental health, lifestyle, just a little bit about everything in general. So make sure you subscribe and join the family. Until next time, guys, take care, stay safe, be kind to one another, and I'll see you on my next video. Bye, guys.